Today on Acupuncture Masterclass, what to do when you have a super sensitive acupuncture client. Let's take a look. Whether you're a seasoned acupuncturist or an acupuncture student practicing on your fellow classmates, you've likely come across this issue. People can be super sensitive to acupuncture. Whether it's anxiety-based or sometimes even hormonal, some people are just super sensitive to the needles. Some people know they're sensitive before they come to see you. They'll warn you. While others, they don't really find out until they're on the table.
Ow.
Today, I'm going to share some simple tips to ensure your super sensitive clients still experience a comfortable, relaxing, and effective acupuncture treatment. Proper equipment. You'll need some proper equipment. Remember, it's not just needles that can make for an uncomfortable acupuncture experience. Consider the following: general patient comfort, a comfortable room with a comfy bed, extra cushioning and pillows at the ready, comfy sheets and towels. These are things you should have already. Once clients are on the table, make sure they are well covered, draped appropriately, and for those who are in cooler climates, keep your patients warm with room heaters or tabletop heaters. Needle sensation just seems to feel worse when it's cold. Obviously, proper needle choice is important. Get to know your needle gauges if you haven't already. You should stock different sizes at your clinic and use a thinner needle when you suspect or notice somebody is more sensitive. Higher end needles are very comfortable these days. The trick is not to go too thin, as super thin needles can be very difficult to insert. I never go any thinner than 0.16 of a millimeter. A call button. A call button can be a lifeline for those who are super anxious or sensitive to needles. This provides clients with an easy way to contact you and makes them feel more at ease when they are alone in the room for their first time. Encourage them to use it for anything they need. Clear communication. Anxiety plays a large role in how sensitive people are with treatment. More anxiety, more sensitivity. Properly communicating with your client before any needling occurs is very important at reducing this pre-treatment anxiety, and is a must for all new people to acupuncture. First, communicate how you want them positioned on the table. You can minimize patient discomfort by using proper patient positioning prior to needling. Limbs should be appropriately bent and relaxed. Ensure clients are not holding their elbows off the table. Everything should be relaxed. Remember, they're going to be in this position for 30 minutes or so, so make sure they are in a perfectly relaxed position. Communicating consent for treatment. This is likely in your intake form, but it's always a good idea to ensure you have consent to treatment before you are about to start, and let them ask any questions they might have. Being informed can also reduce their anxiety. Communicate clearly what needle sensation should feel like prior to starting, and that the sensation usually goes away quickly. For more sensitive points, like points around the hands and feet, encourage a nice deep breath prior to insertion. This can be very helpful at reducing discomfort. Pay attention to their facial expressions. Their face will show when points are obviously strong, and you should get feedback about what they're feeling. Sometimes they just need to know that what they are feeling is a normal reaction to acupuncture. Reassure them that the pain should dissipate. Of course, if it remains uncomfortable or gets worse, particularly around sensitive nerves or other notable anatomy, you may need to remove the needle. Now that the needles are in, you should ask them if they are comfortable before you leave the room. Are any needles uncomfortable, for example? Or are you warm enough? These are simple questions, but can lead to a much more comfortable acupuncture experience for your client. Also, let them know you'll be checking in on them in a few minutes to see how they're doing. I usually do this halfway. This makes people feel better knowing that at some point someone will be back to see how they're doing. Now that the treatment's over, inform them what it feels like to have the needles removed and how things feel afterwards. Sensitivity around the needles can occur at any time you are dealing with the needles, even when you are removing them. Special techniques. Given anxiety runs high with those who are sensitive, consider doing mind calming points like Shen Men with an ear seed to start them off. It's a great way to initiate the treatment and is very helpful for stress. As mentioned before, get them to do a deep breath prior to needle insertion and make sure your tap is appropriate for the area you are working on. Remember, tapping too lightly can make your needle insertion more uncomfortable. Consider mild stimulation techniques first, like just flicking the needle or bending the needle. Then, if you need to, you can graduate to rotating the needle, lifting and thrusting the needle, or a combination of the two. If they're sensitive, you may not need to stimulate the points very much at all. Get feedback from your client about needle sensation and watch their body language for signs of discomfort. Sometimes making a fist or eyes closed tight or some odd breathing, these are cues for you to watch for. Some of my best clients started off super sensitive to the acupuncture process. If you introduce acupuncture to them with the appropriate tools, open and clear communication about what is about to happen, and modified techniques as just discussed above, they will be clients for life. Thanks again for watching. Looking forward to seeing you next time.